Hello, my name is Melissa and I'm going to be your nurse today. Can you tell me your name and date of birth?
I'm Jerry Holcombe, and my birthday's 9/8/55.
Okay, let me check your armband. All right, Mr. Holcombe, that is correct. You told me you're a 60-year-old Caucasian male. Okay, name and date of birth is correct according to your file. The first test I'm going to do today is a visual acuity test. It's a near vision test where we're going to check cranial nerve 2. With your glasses on, I want you to cover one eye with the spatula and read this for me. Just any of those.
Okay, how about the lock on?
Okay.
I see you've gotten over 4 years of your fear of snakes.
Okay. Cover the other eye and read another one.
The boss says I'm indispensable, but only at my current salary.
All right. There's no noted presbyopia with your glasses on. The next thing we're going to check is your extraocular muscles. I'm going to ask you for your glasses. Okay. I want you to stare straight ahead for me. No, right here at me. Stare straight ahead. I'm going to be shining a light towards your eyes, so stare straight at me. Don't move your eyes. Just stare straight ahead. There you go. No noted symmetry of the corneal light reflexes. The next thing I'm going to check is your corneal fields, which is your cranial nerves 3, 4, and 6. I want you to look straight ahead and don't move your head. Follow my finger up, here, and down. Okay. Follow my finger up, here, and down. All right. No nystagmus noted, no lid lag noted. The next thing I'm going to check is your external ocular structures. Can you raise your eyebrows for me? Very good. Eyebrows present bilaterally and move symmetrically. No noted scaling or lesions on them. Eyelids, can you open and close your eyes and let me check them? Very good. Your eyelids are closed and open correctly, skin intact, no redness, swelling, lesions, or discharges noted. Your eyelashes are distributed evenly along the lower lids and outward. The next thing I'm going to do is check your conjunctiva. I'm going to pull your
I didn't know I had one of them.
your lids down. Would you look up for me? Straight up. All right, very good. Eyeball looks moist and glossy. Your conjunctiva appear clear and show no normal color, abnormal color over the lower lids, white over the sclera. So the next thing I'm going to do is check your corneas. I'm going to shine a light across your eyes. Just look directly at me, okay? All right. No abnormalities or corneal surface. No noted opacities in the cornea. Your irises appear flat with round, regular shape and even coloration. Your pupils appear round, regular, and equal in both sides. The next thing I'm going to do is I'm going to get you to gaze over my shoulder in the distance. Okay? I'm going to use the light again, Mr. Holcombe. Just hold your gaze in the distance. All right. Resting size is 4 and decreases equally in response to light. And the last thing I'm going to check is your accommodation. I want you to focus on a distance object again. All right, I'm going to hold my finger up and bring your gaze to my finger. All right, very good. Noted papillary constriction and convergence of axes of eyes. Accommodation is perla, pupils equal round, reactive to light and accommodation. Thank you, Mr. Holcombe. His visual acuity had no noted presbyopia with glasses. Extraocular muscles showed symmetry of the corneal light reflex. Cardinal fields showed no nystagmus and no lid lag. His eyebrows are present bilaterally and move symmetrically with no scaling or lesions. Eyelids, the upper eyelids overlap the superior part of the iris and approximate completely with lower lids when closed. The skin is intact without redness, swelling, discharge, or lesions. Lashes are distributed evenly along the lid margins and curve outward. is on his conjunctiva. The eyeballs appear moist and glossy, appear clear, and show the normal color of pink over the lower lids with white over the sclera. No noted abnormalities on the corneal surfaces and no noted opacities in the corneas. Irises appear flat with round regular shape and even coloration. Pupils appear round, regular, and equal in size. On direct consensual accommodation is Perla. Pupils equal, round, and reactive to light and accommodation. Okay, there's one last test that we're going to perform, and that is the red reflex test. I want you to look at a mark over here on the wall, okay? And just keep your eyes on that mark on the wall. All right, stay focused on the mark on the wall. Okay. No noted opacities found in the red reflex. All right, Mr. Holcombe, that ends our visual screening, and now what we're going to start is our auditory screening. I'm going to stand behind you and do a whisper test, which is going to check cranial nerve 8. So if you'll turn on the stool. Okay. I am going to close this ear and whisper. Can you repeat what I said?
1A, 2B, 3C.
All right. Can you repeat what I said?
1A, 2B, 3C.
All right. Thank you very much. He has whispered sounds are heard bilaterally. The next thing I'm going to check is his external ear. If you'll turn and face me. Okay, they appear equal in size bilaterally. I see no swelling, no lesions. Color is consistent with his facial coloration. I see no nodules at the helix. All appears normal. Okay, I'm going to check inside your ear. I'm going to do an otoscope inspection. Pulling the ear up and back. The canal appears clear with no obstruction. The tympanic membrane appears gray. Okay, I'm going to come around to this side. Okay, go ahead and turn on the stool for me. Let me check this ear. Okay, pulling up and back. The canal appears clear with no obstruction. The tympanic membrane appears glossy and gray. All right, thank you very much. Okay, the next thing I'm going to do is I'm going to check your nose. If you'll face me, the nose appears symmetrical and midline in proportion to your facial features. No sign of deformities, inflammation, or skin lesions. I'm going to check the patency. Can you sniff for me? All right, check the other side. All right, no obstructions noted. Nasal membranes, I'm going to get you to tilt your head back, and I'm going to look up in your nose. Not too far back, Mr. Holcombe. Thank you. All right. I notice no obstructions in the nose. Normal red in color, moist and smooth surface. I notice no swelling, bleeding, discharge, or foreign bodies in the nose. Next, I'm going to check is your sinus palpation. I want to palpate your sinuses. Okay. No tender, non-tender to palpation. Okay, your lips appear pink and moist. No cracking or lesions on them. I'm going to check inside your mouth real quick. No, put your tongue in. All right. Teeth appear normal, straight, clean. Okay, bite down for me. All right. You have a positive alignment of the upper and lower jaw. I'm going to pull down your bottom lip. Gums appear pink. Margins are tight. No swelling, infection, bleeding, or discoloration noted. Okay, can you touch your tongue to the roof of your mouth? All right. I noticed that mucosa is pink. Salvia is present. Can you stick your tongue out for me? Oh, pull your tongue side to side. Okay. Thank you very much. Color is pink and even. Dorsal surface is roughened. No notice white patches. Or nodules or ulcerations. I'm going to check your palate. I'm going to get you to open your mouth for me. Okay. Very good. Interior palate is white. Posterior palate is pink and smooth. Now I'm going to check your throat for me. Can you push the side of your tongue back? Just lower it down in your mouth for me. Okay. Color is pink. No exudate noted. Your tonsils are 2+, pink. Okay. No exudate noted. Okay. I'm going to get you to say "ah" for me, Mr. Holcombe. Hold your mouth down. Say "ah." Okay. Very good. Soft palate and uvula rise in the midline. Okay. We're going to check cranial nerve 2. Can you stick your tongue out for me? All right. Tongue protrudes to the midline. Okay. I've got 2 other hearing tests that I need to do real quick. We're going to do the Weber test, and I'm going to ask you to, I'm going to clip this fork, and it's going to make a ringing sound. Okay? And I want you to tell me if you can hear the sound better on the side or in the middle. Okay. I'm sorry. I messed that up. Let me start over. I'm going to do it again. I'm going to flick this and make it ring. And I want you to tell me if you hear the sound better on the sides or in the middle. Okay?
In the middle.
All right. Very good. Next test I'm going to do is the Ryan test, and then I'm going to do the same thing, but I want you to tell me if you hear the sound better beside the ear, or if it's twice as long.
What's the choices?
A, beside the ear, or B?
A.
A, okay. The sound is heard twice as long by air conduction on A. All right. Your skin is intact with no masses, lesions, tenderness, or discharge on your ears. External canals are clear with no redness, swelling, lesions. Foreign bodies are discharged. Both tympanic membranes are pearly gray in color with light reflex and landmarks intact with no perforations noted. You respond appropriately to conversation. Whispered sounds are heard bilaterally. Sound is equal in both ears. Sound does not lateralize. The Ryan is positive with sound heard twice as long by air conduction. Your nose is symmetric. No deformities or skin lesions. Nares patent, mucosa pink, no discharge. Lesions or polyps, sinuses are non-tender to palpation. On your mouth, you can clit your teeth. Mucosa and gingiva are pink. No masses or lesions. Teeth are all present, straight, and in good repair. Tongue is smooth pink, no lesions. Protrudes in midline and no tremor. On your throat, your mucosa is pink, no lesions or exudate. Uvula rises in midline on phonation. Tonsils are 2+, pink with no exudate noted. Thank you very much, Mr. Holcombe. I appreciate your time today.
You caught me on a good day.
Very good. I'm glad I did.